My name is Dr. Claudia Mika. I am the chairperson of the EFS Certification Committee, and I'm also the CEO of Demos International Healthcare Accreditation. So what inspired us to prepare and develop the PCCCP program, as we call it in short? I joined the EFS when our great colleagues already had prepared a guideline on patient-centered care. And when we went through the program, then we said we should bring together the patients and the clinics via a tool which shows that hospitals or fertility clinics in hospitals do show that they have a special program on patient-centered care. So bringing together the excellent content from the guideline and share it, show it to clinics to qualify themselves for such a program, plus then involving patients and support patients for the decision-making process, where to get the treatment, how to choose the clinic. This was what inspired us in the end. So to have all the stakeholders together, and we are talking about a very sensitive topic, which is reproductive care. So we wanted that patients, while seeing this seal of trust in the end after the certification, that they choose and that they trust in the services, that they have somehow peace of mind. And this is, I think, what we managed to do in this program. As the program name says, it is all about patient-centered care. From the first contact of a patient with a clinic until the patient has left the clinic and later on when the result is given, etc. So all the different steps in the process of the patient journey are covered from the non-clinical perspective. This is very important. So we are not competing with any international accreditation or certification program. We focus specifically on patient-centered care. This includes communication. This includes information management. So how is information spread, provided to the patient? Which non-clinical services are available? So from the access to the services, also for handicapped or disabled patients, to which communication tools are available. Is there a care coordinator or similar? Is the quality management system implemented? These are some of the main factors or criteria we check during the certification process to ensure that all non-clinical services are covered accordingly. As far as I know, there is no such a certification program at all, focusing on the non-clinical services and specifically on patient-centered care. To my knowledge, there's non-existing. This plays a role in other certification accreditation systems, but this 100 questions and 100 points we ask in our certification program for EFS, this is simply not available. So it's the first time, it's unique in its kind. And this is all I can say for this. There is none other for this. And this is because of the points we choose from the EFS guideline and transfer them into a certification program. So no other system or no other program is available for that. As I said before, for me, reproductive care and the respective treatment is a very sensitive area. And many patients are getting lost even before they even decide to go this journey for reproductive care. So when we talk about long-term patient satisfaction, I think this then reflects the complete journey of the patient from the first contact, then getting the explanation, the options for treatment in a way that is understandable, that patients get enough time to take the decision, to have the alternatives, to have a contact person, to have high quality access to care, medical care, nursing care, assistant care, then to have a contact person for questions in between when there is a situation where there's some uncertainty or where emotions are overwhelming, to have somebody then taking the hand and guiding them to the next step. If there is sadness, if there is frustration, this all is in the end very important for the overall experience. And this then is reflected also in the long-term patient satisfaction. So I'm satisfied with the services I obtained, even if it was not successful in the end, if somebody took care of me during the whole process. And this is what I then would reflect in if I'm asked as a patient in my satisfaction questionnaire. So it is the overall process guidance, support from the emotional, professional, medical perspective, which makes it then a good experience and also satisfaction. I think this is the main and the strongest part of such a certification system which reflects exactly those processes by evidence-based criteria and standards in the end. As the first step, the clinic should be convinced for itself and should be confident to pass the certification. And how can they be confident or feel confident? They should know about the guideline requirements and the requirements for the certification program, and then they should start. So they must have, for example, a quality management system implemented. There must be a policy on patient-centered care. There must be a team that is taking care about the patient-centered care approach. So these are evidences which have to be provided to us as part of the application. And while applying to the system, then the organization gets further information, gets access to all what is needed then to continue. But the first conditions is, as I said, the policy, quality management, a respective team, and that the team itself is convinced that they do an outstanding job for patients, for the reproductive care treatments they offer. We have 3 steps where the clinic has to act or react. The first is to apply. And with the application, some data have to be provided, of course. And then the first step is to do a self-assessment. And in the self-assessment, we have a questionnaire of 100 questions. And for each question, we do have some further guidance. And we have the suggested evidence. So it's not only that the question has to be answered, and it's easily done with yes, which is, of course, the most preferred answer. But it is also that by further guidance and the evidence we mentioned, that the clinic should be sure that they do have the evidence. And if not yet, then they should be able to provide the evidence in the second and third step. So first step is the self-assessment, to fill out the questionnaire, to understand all the questions and answer them correctly. The second step is a 2 hours interview with the clinic team, with a different department and representative for the areas of the patient-centered care program. And in this 2 hours interview, we ask questions and ask for evidence, ask for explanation, how they realize the respective topics and questions from the self-assessment tool. So here we get personal exchange, and this is done by 2 assessors from EFS. So they are qualified, they are experienced, the questions are prepared in a catalog, and this is direct exchange. In the third step, after the interview took place, then we ask for further evidence based on the outcome of the second step, the interview. So, for example, if we get some explanation that, yeah, this is described in a policy, or this is a standard operating procedure, we have a video for this and that, then we request afterwards to provide us with this evidence, which will be then also checked by the assessors. And if all 3 steps are fulfilled sufficiently and satisfactorily, which means that we have a percentage of at least 85% passing rate, then this is then not up to the clinic, this is up to the the decision-making board at EFS, then we can award the certificate. This is step 4 in a way, but this is the step then from EFS. This really depends on how much the organization, the clinic has already prepared. It can take a few weeks, it can take 3 months. So depending on how fast the self-assessment tool is responded to, is answered, the questions are answered, and the respective yes for the passing rate has been reached, then it can be fast and we can schedule the interview. And if during the self-assessment the clinic sees that, oh, we thought we are very good and we are good, but here and there we have some gaps, then they have the time to fill the gaps first. It may take a few weeks, and then we continue and schedule the interview. In an average, I would say between 2 weeks and 3 months. This is an average. And here we have different options. One could be that they submit a document or show us during the interview the document on the screen. Other evidences could be, this is what we also had, that we got a tour, a virtual tour with a video camera through the whole clinic because we wanted to see the environment. So video could be that we get photographs to show, for example, the areas where we have handicapped access, how this is realized. So it's documentation, it is videos, it is photographs, it is perhaps statements or links to the website, links to patient testimonials. So these all media, all options we nowadays have, we would accept as evidence. And depending on the question, then sometimes it's more documentation based and sometimes it's more visualized to show us what the clinic has, because it is in the end not an on-site visit, which is included, as I mentioned before, that is a desktop and an interview and self-assessment. So therefore, it's important to us to understand and to see what is behind the services. And for this, pictures, images, videos are very helpful. I think one common challenge is that since we talk about clinics, we are not regularly talking about big hospitals, that in small clinics, a real quality management system, as we understood from our perspective, is perhaps partly implemented, not full. This is completely understandable because in a clinic, we don't have too many staff members and we have different heads on, are responsible for different things. So a pure quality management system, as we may expect, sometimes is a challenge. So when we talk about, or when we ask for policies, procedures, this and that, then we sometimes see that it's not always completely understood, and we then explain it. So this may be one challenge. Another challenge is that we see now from the experience from the first certification assessments that clinics think that they do have an outstanding patient-centered care, which is true. But when we then mirror reflect it by our questions and get the answers, then we heard, oh, here I had to have a no first, but I understand and I have to change this now. So this is a kind of gap analysis, the self-assessment tool. And clinics see that, oh, here and there is a gap between the EFS guideline, which is then transferred into questions in the certification program, and what is the real or reality in the clinic. In most of the cases, it's just to fill the gap with additional service provision or with minor changes here and there. But this is the feedback so far that, oh, I underestimated a little bit the questions, and now after I've understood, all good, all agreed, and we implemented the missing points. One thing is to read the guideline. The guideline is available free of charge. And this is, let's say, the underlying document from which we extracted the self-assessment tool and the complete certification program. So to read the guideline, to get familiar with it, and to check, although these are not really checkpoints, but to read and understand the guideline, then this helps a lot. And in the end, the second point is to start, because the first part, the first level, the first step is the gap analysis, the self-assessment. And we are not putting pressure time-wise. So if somebody wants to start and wants to go for the certification program, and they have read the guideline or have not read the guideline, but start the application process and start the self-evaluation tool, and there are some gaps, no problem, fill them, and then you continue with the interview on step 3. So that's the best thing to prepare.